My name is Dr. Kelly Bolton. I'm an assistant professor at Washington University. And this evening, I presented data from a clinical trial that I'm the principal investigator on, where we were giving the drug Ivosidenib to individuals with IDH1-mutant clonal hematopoiesis of undetermined significance. So I'll explain this. So basically, we think that the cause of MDS and AML is mutations in the stem cells in our bone marrow that over time can expand, acquire additional mutations, and eventually lead to AML and MDS. A lot of these people we think progress through this phase where they have both these mutations in the blood and abnormal blood counts before they develop MDS or AML. So we know from population-based studies that individuals with mutations in the blood in the genes IDH1 and IDH2, which are drivers of MDS and AML, are at high risk of progression. And especially people that have IDH1 and 2 mutations and cytopenias, those people seem to be likely at some point in their lifetime to develop MDS or AML. So we wanted to see if we could intervene early to prevent the development of cancer in these individuals. And also we wanted to see if we could improve the cytopenias that these individuals have by treating early. So the design of the study was really to identify people with IDH1 mutations that were reasonably healthy, that had persistent cytopenias for at least 6 months. And we gave them Ivosidenib, the normal dose, for up to 5 years. Our primary endpoint is hematologic response, and we use the IWG criteria. We have secondary endpoints of improvement in VAF, progression to AML and MDS, and safety. And so we opened this actually as a decentralized study because IDH1 and 2 mutant CCUS is pretty rare. It affects less than 3% of all CCUS individuals. So it's a decentralized study in that it's open to patients across the country. And we ship drug directly to patients, and we work with local providers, and we do remote study visits to assess for safety. And so it's been going really well. We've enrolled now our goal of 20 patients. And we see in these people really amazing response rates. So we see that out of the 20 individuals, 18 had a hematologic response. And then over 14 months of average treatment, only 2 progressed to MDS and AML. And we also saw that the vast majority, 95% of the participants, had a decrease in the IDH1 VAF over time. So we're really excited by these results. And we think this means that treating early in the CCUS setting shows a lot of benefit and might ultimately be a better way of treating IDH1 mutant myeloid neoplasms, actually, by getting them at this earlier CCUS setting. We have ongoing correlative work where we're trying to look at clonal evolution in the patients over time, but we're very excited by the results. And just so you know, we also have a second clinical trial that's still ongoing, very similar design, giving Ivosidenib to IDH2 mutant CCUS patients. And so, again, this study is a decentralized study, so it's open to anyone across the U.S. So if there's any providers that are watching that have patients, please reach out to me about possibly getting more information about the study.